Now, let us have another discussion of pharmacology, and today we are going to discuss about the central nervous system or nervous system drugs, because we are going to look also at the autonomic nervous system, that is sympathetic and parasympathetic system. Now, our topic today is about anticholinergic drugs. But before we start discussing about these anticholinergic drugs, we have first of all to check on some few points in terms of physiology and anatomy of the central nervous system, so that we can be able to understand that these drugs, how they work and the point where they work. As an introduction, you'll see that we have somatic nervous system, where this one it involves the cells. You have the central nervous system, you have the peripheral nervous system, and also you have where they work, that is the effector muscles or the effector organs at the point where they work. Then we have autonomic nervous system, which is divided into two. We have sympathetic division and parasympathetic divisions, which works against each other. We have a sympathetic system, which works using the norepinephrine and the epinephrine pathways. You see them, both of them, where they work. Where they do work. So in this case, you'll see that anticholinergic drugs, they work in the somatic nervous system. They work at the skeletal muscles, where the stimulation at the peripheral nervous system at the effector muscle, for example, the muscles, that is where in the somatic nervous system, that is where they work. Whereas in the autonomic nervous system, they work, anticholinergic work at the cell junction at the ganglion, where the nervous, that is the cell junction at the nervous, where one cell is having a joint or meeting with another cell. That is where this or the work in the sympathetic nervous system. Also, they work at the adrenomedulla, and also they work in the parasympathetic division. They work both pre and post of joint point, from the junction of the junction of our cells. That is where they work in the parasympathetic system. Now, non-muscarinic agents works again at the effector point, where the somatic nerves system, that is the peripheral nervous system, where it hits the effector, it hits the effector organ like the muscles. Then the non-magnetic works at the ganglion, adrenomedulla, and also before the parasympathetic, before the cell junction, and also in the sympathetic is for the cell junction. Again, in the parasympathetic system, it works after the cell junction at the point of the effector organ, and in this case, the heart. So the neuromuscular brokers, they work in the somatic nervous system. They work at the effector organ. That is where the nerves is meeting the effector organ. For example, where the nerve is meeting the muscle, that is where they work. The neuromuscular brokers. That is in the somatic nervous system. In autonomic nervous system, they work at the ganglionic blockage, that is where the one cell meeting another cell, and also they work at the adrenal medulla, and also in the parasympathetic, they work before the ganglion, where they stop the passage of message at that junction of the cells. The muscarinic effect works after, that is at the effector of parasympathetic system. So in summary, that is the summary of the topic of we are going to cover today. Now, we are going to understand these anticholinergic drugs in terms of classifying of these drugs. We check their pharmacodynamics, actions of anticholinergic drugs. We will look at and discuss their pharmacokinetic properties. We will define their clinical use and their adverse drug effect and contraindications of these drugs. So let us start with anticholinergic drugs. So the anticholinergic drug is, for example, antimuscarinic drugs. Antimuscarinic drugs, we have to see them according to their source. Here's the natural one. An example is atropine, which is from a plant called Atropa verandola, which the main function of this one, it has effect on the eyes. The atropine has effect on our eyes. The other one is iosine, which is from the plant called Iosinomas nigra, from that plant. So it's a natural product. Then we have semi-synthetic types of antimuscarinic drugs, like omatropine. Synthetic, you have ipratropium and tropicamine. According to the structure, we can classify them according to the structure. And the ones which have tertiary amines, and the other ones have quaternary ammonia, and like an example, ipratropium. Then we have, according to the selectivity, we have non-selective and selective. An example is pirazepine, which works on muscarinic 1, and difamine, which works on difenamycin, which works on muscarinic 3. So let us see the mechanism of action of these antimuscarinic drugs. So these drugs, they compete for the blockage of muscarinic receptors. You can see that the muscarinic receptors and the one which attaches it is acetylcholine. But at this point now, you see that iosine and atropine is competing for it, the muscarinic receptors displacing acetylcholine. They are displacing. That is the mode of action. They displace acetylcholine at the muscarinic receptor. So the salivary glands, bronchioles, and the sweaty glands are the most sensitive to these types of drugs. They're the most sensitive to these drugs. So smooth muscles and arteries are intermediately, not all that high. Then we have gastric glands and gastric smooth muscles are at the wrist. So let us see the pharmacodynamics of these drugs. The pharmacodynamics of these drugs, they have some effect on the brain. They have effect on the brain, that is on the central nervous system. The atropine at clinical dose, it can initiate a stimulation at a clinical dose, but followed by a slower longer, it causes a lasting sedative effect. So iosine, which is very commonly used as buscopan, it has some sedative effect. Then atropine stimulates many medullary centers and the vagal and respiratory and vasomotor. And high doses of atropine can cause cortical excitation, restlessness, and dissolution, hallucinations, and delirium, followed by a respiration depression and also coma. So you have to be very careful when you are using this drug. So in the cardiovascular system, atropine can cause tachycardia. It's an isolated heart due to blockage of muscarine 2 receptors on sinoatrial node. In intact animals, initial bradycardia followed by tachycardia. You can see the atropine receptors and the effect how they behave in the muscarine. You see know that the muscarine 2 is the one which were at the sinoatrial node. Atropine shortens the refractory period of ventricular conduction. So it can cause, it can be associated with heart block, rate interventricular conduction is reduced, and then heart rate is increased. Atropine does not influence blood pressure. It blocks vasodepression, action of cholinergic agonist. In the eyes, it relaxes the pupillary constriction, causing mydriasis. Causing mydriasis. It also relaxes the ciliary muscle, abolition of rate of reflexes, and the sacrophagia. Can go into sacrophagia. It can cause increased intraocular pressure. It can reduce lacrimal secretions, as if your eyes are dry. In the respiratory system, atropine can cause bronchial dilatation and reduced secretions. So the secretions in the respiratory system can be reduced because of atropine. In the GIT, it can reduce GIT mortality, reduce GIT secretions. This one can result to dry mouth, acid production is reduced, pancreatic secretions is decreased, and viral peristalsis is reduced. In the genitourinary system, atropine can cause a reluctant action on the uterine and the bladder walls. This one can lead to urine retention and can occur in women and prostatic hyperplasia. Can do open. In the sweating glands, atropine causes decreased sweating because it blocks muscarine 3. In children, modest doses can cause what is called atropine fever. Cause sweat production, flaccid dry skin, evaporative loss, increased blood flow for increased inspiration. So in summary, atropine reduces saliva, reduces micturition speed, increases heart rate, and reduces ice accumulation. Atropine and the iosine are rapidly absorbed from the GIT as pharmacodynamics. When applied to the eyes, they penetrate the cornea. Passage of atropine across blood-brain barrier is restricted. 50% of the atropine is metabolized in the liver and excreted in urine and changed. Atropine has a half-life of 3 to 4 hours. Iosine is the more completely metabolized and has better blood-brain barrier penetration. In the central nervous system, the use of this drug is atropine is used in Parkinsonism. These are neuropeptide disorders. It is also used in, that is Parkinsonism use benzodiazepine and also benzotropine. Motion sickness also is used. They are used in motion sickness. This drug like iosine used in ophthalmic disorders for the purpose of ophthalmic examination because it is a dilatation of the eyes. In the GIT, ulcers, pyrazipine is used in the treatment of GIT ulcers in irritable bowel syndrome, chronic diverticular disease like diacylcromen and glycopyrrolate is used. In the traveler's diarrhea with opiate. In the biliary and the renal colic can be used. These drugs can be used and we use Buscopan, and also in urinary agitated caused by minor inflammation of bladder disorders, urinary incontinence. You can use oxybutamine and difenaclic, which blocks masculine drain. In the respiratory disorders, they are used in preoperative medication when anesthesia is expected to be administered, and this one results to increased excretion and range of spasm. Iosine can cause amnesia, bronchial edema, and chronic obstructive pulmonary disease is a clinical side effect. Yttrium inhalation, which is used as in treatment of asthma, can have cardiovascular effect, can cause myocardial infarction, depression of the cell, atrial node, and the baby node. This one is a type of sinus rhythm. This the second one is the near then, but you can see the first one is showing something what is called triangular T wave, which is a sign of myocardial infarction. Cholinergic poisoning, cholinesterase inhibitors, insectines, atropine, acetylcholine plus receptors, they are used there that was in post-analytic. Mushroom poisoning, can use them. Hyperhidrosis, you can use those drugs. And also the adverse effect of this drug is that they make you not pass urine, you're not able to see well, and you can't speak because you don't, and you cannot even go to toilet. So they can cause mydriasis, blood vision, they can cause confusion, agitation, delirium, dry mouth, hot flash, sickness, and constipation and urinary tension and tachycardia. Increased body temperatures. Okay, this one you can they make you to blend like a bit, they make you dry as a spoon, they make you bright as a bat, they make you full as a flask, they make you mad as a hen, they make you hot as a hell. These drugs are contraindicated in glaucoma, in elderly people with prostatic hyperplasia, tachycardia secondary to thrombotoxicosis or cardiac insufficiency, paralytic areas, and selective interbrocas ulcers. So let us see whether we can remember whatever we have discussed. So a patient is brought into the emergency room. Upon examination of your findings, you find the following: temperature is high, pulse is rapid, no vital signs are dilated, pupils that do not respond to light. His lungs are clear, his face is burst, and his skin is dry. He's confused, disoriented, and is not seeing monsters. Based on these symptoms, we suspect he has been poisoned. Which of the following is the most obvious cause of poisoning? Most common like of poisoning is atropine. Okay, because this patient fever, pass, non-viral sounds, dilated pupils, those are the effect of all these atropine side effect. Question number 2. You are working in the post-anesthesia care unit or hospital. You have just received a patient back from surgical and you are monitoring his status, knowing that the patient has received atropine. Which of the following statement or solution is right? The patient is complaining of extreme dusty. Yes, that's a side effect of atropine. So that is something you expect it. The patient is complaining of he is unable to see clearly. Yes, because it causes frustration of the eyes. The patient heart rate is high. Yes, because it causes elevated heart rate. It's elevated because of the M3. The patient report he has eclampsia and the point is D. That one is not a side effect of. And that is the end of this lecture about none. That's anticholinergic drugs. Thank you very much for listening to this lecture.